Welcome back to the Chat with the Expert series. We have the pleasure today of chatting with Taya Salomonia Bishop, Senior Staff, Elder Law Practice and Public Benefits Unit Attorney at NILAG. Taya will be presenting part 3 of our 4-part ongoing conversation on Medicaid. Today's talk is entitled Pooled Trust, A Pathway to Medicaid Eligibility. And we're welcoming back Taya because last year she presented, and she'll have many new updates for you today. For those that don't know me, I'm David Knapp, Program Director of the Small But Mighty DIFTA Bill Payer Program, and I'll be your host today. Before we get started, please take a quick minute to take a pre-chat survey. We have a couple questions to ask you. We're trying to get a sense of people's knowledge of the various topics that we're presenting. We'll do a pre-test now, a pre-questionnaire and a post-questionnaire. So Kevin, you can post that. We'll also be sending you all some information related to all of these questionnaires at the end of the year. Now, I'm happy to present, as we always do, the Commissioner of the New York City Department for the Aging, Ms. Lorraine Cortez Vasquez, for some pre-recorded opening remarks.
I want to welcome you to the second season of Chat with the Expert. I am Lorraine Cortez Vasquez, Commissioner of the New York City Department for the Aging. In the middle of COVID-19 pandemic, DIFTA launched our exceptional Chat with the Expert pilot, with an eye for providing up-to-the-minute information and advocacy around the complex issues of ongoing financial exploitation and fraud. From the beginning, we wanted to connect our audience, you, with area experts who can provide detailed knowledge, tips, advice, and additional resources. As we launch this year's lineup of topics, I hope you will continue to find them meaningful as you seek answers to questions and solutions to the problems you face or that your family may be facing. We believe knowledge properly disseminated is power. I would like to thank our partners at PSS for their continuous support of this series. I hope to see you at the next Chat with the Expert episodes. Stay safe, everyone.
So I just want to give a reminder to everyone that this webinar is being recorded. I'll say that several times. Today, Taya will not be giving any specific individual legal advice. Please don't ask her. If you have an individual case, you can reach out after today's presentation. Please make sure that your questions are more general in nature. We will be sending out all of the slides and all of the resources that Taya has presented today. Don't forget, this is the Chat with the Expert, so place all of your questions in the chat, and in real time, we will get back to you. And we will have a section at the end of our presentation, which will be live questions. For those of you today that are from a DIFTA agency, if you want us to verify that you were on, please use the individual specific link that we sent out to you that you registered with. If you're on someone else's link, there's no way for us to actually verify that you were on today's presentation. Today's, again, topic is Pooled Income Trust, a Pathway to Medicaid Eligibility. And now, without further ado, I want to welcome back Taya Bishop. Take it away, Taya.
Good morning, everybody. Thank you so much for joining me. I'm Taya Bishop. I'm a senior staff attorney at New York Legal Assistance Group, and I work in the Public Benefits Unit doing the elder law practice. A little about NILAG. New York Legal Assistance Group, NILAG, is a leading non-for-profit that provides free legal services, financial counseling, and engages in policy advocacy efforts to help people experiencing poverty. I want to once again thank PSS DIFTA for inviting me to this program. And without further ado, I want to present what we're going to be talking about today. So today we're going to cover, in brief, Medicaid, who needs Medicaid, what are Medicaid eligibility rules, and partly because my colleagues from FLRP covered this in great detail for the first 2 parts. And then we're going to dive into what is Medicaid spend down, what is a pool trust, how do I join a pool trust, and how do I use it? Okay, and as David said, today's presentation is not meant to be specific legal advice. It's general in nature. Okay, so what is Medicaid? Medicaid is health insurance.
Sorry, Tia, I apologize. Your PowerPoint, you have to share your screen.
Thanks, Kevin.
Okay. My apologies. Okay. So we're going to, I guess, go back. So this is the agenda. And as I said, so what is Medicaid? Medicaid is a health insurance for low-income individuals and families. It provides comprehensive coverage for medical services, including services in the community and coverage for nursing home care. Medicaid is run by a combination of federal, state, and local laws, regulations, and policies. It is funded by the Federal Centers for Medicare and Medicaid Services, New York State Department of Health, and local Department of Social Services. Community Medicaid benefits include basic health care, dental, vision, hearing aids, adult daycare, home care, assisted living, and transportation. So why are we talking about Medicaid? Primarily, Medicaid is the only benefit that provides long-term care. Medicare does not cover long-term care services, and if it does, it covers it on a very limited basis, where if you need to have skilled nursing services like OT and PT, and you must be homebound. Of course, paying for long-term care out of pocket is very expensive, and Medicaid can cover up to 24 hours, 7 days per week of home care. Also, there's this notion of, if you have Medicare, you're underinsured. So, and some of the costs can be prohibitive. Medicaid will provide coverage for Medicare Savings Program. It will pick up the cost for the Part B premium, and the QMB level will also pay for the deductibles and the coinsurance. Of course, you will also qualify for extra help for Part D prescriptions, and activating Medicaid for just 1 month will turn on extra help for the rest of the year. And if it's activated July through December, it will give you coverage for extra help for the following year as well. So Medicaid is great, but eligibility is important because we need to kind of understand how do we get into the realm of Medicaid. So if you're under 65, you're typically in the Magi Medicaid world, getting access through the Affordable Care Act, where the income limit is 138% of the federal poverty level. There is no asset test, but you cannot spend down your income. Whereas in the DAB, or the disabled aged blind category, you're age 65 and over, but you're going to face monthly income test and an asset test. So what are these tests? For purposes of the assets or the resources, we're talking about an individual cannot have more than $16,800 in this category, and a couple cannot have more than $24,600. For purposes of monthly income, an individual cannot have more than 934 plus 20, so 954, and a couple cannot have more than 1,367 plus $20. And you've heard it once, you've heard it twice, and you'll hear it again, and this is great news. The income levels and the resource limits are being raised come 2023. And this is great news. Hopefully more of you will be able to qualify for Medicaid, and you won't need to use various channels, for example, like the pool trust that we're talking about today. But even if you do, hopefully the actual spend down will be lowered, and we'll discuss that in more detail. Okay, so the non-Magi Medicaid category, the disabled, aged, and the blind, Individuals who are over the Medicaid income limit can still qualify for coverage. If you remember back in part one, there was this myth that Anna had talked about, if I'm over these limits, can I still qualify for Medicaid? And the answer is yes. And these are various pathways. You can always deduct the first $20 of your income, and you get to take a deduction for health insurance premiums that you pay on a monthly basis. For example, the Part B premium, the Medicare Part B premium, which this year is $170. There's also certain exemptions. For example, income like Holocaust compensation or reverse mortgage is not counted and gets deducted from your gross income. There's also the earned income disregard, where the first $65 is taken away from the earned income, and then that's divided by 2. There's the special housing deduction, where if you've spent more than 30 days in a nursing home, you get to, and you go home with managed long-term care services, depending on where you live, you get to take a deduction for that, for that amount. Spousal refusal is another popular way to reduce your monthly income. For example, you have a husband and wife, and you may have the ability to say, okay, one spouse is going to say, I am not going to be contributing my income to my other spouse who needs Medicaid eligibility. And as a result, the total householding, the income for that individual that is applying for Medicaid is reduced. You may also qualify for spousal impoverishment protections if you have a household of 2 and only one spouse needs managed long-term care services. Then you can use spousal impoverishment protection to qualify the other spouse that needs the MLTC services. And this allows for a higher income limit per household. And you have the Medicaid buy-in for working people with disabilities, where the income limits are much higher. And the supplemental needs trust is highlighted because this is the topic of our discussion today. And I'm going to discuss how we can go about qualifying for Medicaid. I want to also note that sometimes we use these various different pathways in conjunction. For example, you may still need to use a supplemental needs trust if you have a household of 2 and one you're using a spousal refusal. One of the spouses that needs the Medicaid may still need a supplemental needs trust. So just keep that in mind. Okay, so what is a Medicaid spend down? I know this has been discussed, but let's go over it. Some people have too much income to qualify for Medicaid. This amount is called excess income or surplus income or spend down, just to make things confusing. And to qualify, people with disabilities and adults 65 and over can spend down their excess income on a monthly basis, and as a result become eligible for Medicaid services. Now, these 2 graphs here are gross oversimplification of how a spend down is calculated, but it's helpful to visualize it. So if you're a single, the 934 plus 20, 954, you're allowed to keep that. And if your income is within or under that limit, great, you've got Medicaid. If it's over, even by $1, then you're over the Medicaid limit. And we're going to talk about how we can spend it down and what are your options. Same thing for a household of 2, where you have an income of $1,367 plus 20, great, you get Medicaid. But if it's over, then you're going to have this spend down. I'm going to talk about how we calculate that. So your options for the spend down, this excess income, is 1, pay-in program, which I'll be honest with you is not very popular because any dollar that you're paying into the Medicaid program is a dollar that you cannot use towards your expenses. So, having a limit of $954, typically in New York City, especially, rents are exorbitant, and you need every dollar of your income to, continue living. But however, the paying program might be a good option for people that have a very low spend down. For example, you may have an income of $10,054 and your spend down is only $100. That might be an option. You might think about that. And that $100, think of it like a premium payment. Today, I get my health insurance through my job, and I have to pay on a monthly basis a certain premium to have coverage. You may think of the spend down like that. You have to pay into the Medicaid program on a monthly basis. So the other option could be submit paid or unpaid medical bills to the local Department of Social Services. So that $100 that we talked about, you can present medical bills, paid or unpaid, and submit it to your local DSS to offset the spend down. And of course, the third option is to deposit the money into a pool trust. And we're going to talk about why this may be a really good option, because that $100 that you deposit into a trust is still available to you. Okay, so what are the benefits of a pool trust? Well, you get to qualify and maintain eligibility for community Medicaid to get healthcare benefits and long-term care services like home care without a complete loss of resources and financial independence. You get to utilize excess funds for living expenses and enhance quality of life and maintain comfort and independence in the community. So the money, instead of completely being lost to you, is available to you, and we'll talk about it in more detail as to how. But keep in mind that another benefit of a supplemental needs trust is that you get to qualify for the program, Medicare Savings Program, in which New York State pays for your Part B premium. Currently, in this year, 2022, the Part B premium is $170. By contributing to a trust, you can get the $170 basically put back into your income, Social Security income, and you get to eliminate your Medicaid spend down. And in most cases, this will more than cover the monthly fee charged by the supplemental needs trust. Okay, so what is a pooled supplemental needs trust? A pooled supplemental needs trust is a special type of trust in which a non-for-profit trustee agrees to hold assets for the benefit of a person with disabilities to preserve that person's eligibility for government benefits. Okay, the beneficiary must have a qualifying disability under the Social Security Administration's definition, and funds in a trust can be used to provide for quality of life expenses and purchases. Both federal and New York state law permit use of pooled trust for people with disabilities for purposes of determining Medicaid eligibility by permitting the sheltering of excess income and/or resources. The trust assets are pooled for investment and management purposes among many beneficiaries, but activities tracked separately in sub-accounts, so you never have to worry about, how much money do I have left? It's tracked almost like a bank account. A trustee is a non-for-profit organization and manages the funds and administrative operations on behalf of the beneficiary. So the money is invested, you don't actually have to worry about what kind of investments have to be performed. The trustee takes care of that. The beneficiary can be of any age, but for purposes of today's conversation, it's people with disabilities or age 65 and over. And it can be established by a beneficiary themselves, but they have to have mental capacity, or by an agent with a power of attorney. And you do have to submit the actual power of attorney, both to the trust and the Medicaid administration. It's funded with the beneficiary's income. This is an important point because so once you determine the spend down, let's say it's $100, that $100 has to come from the actual Medicaid beneficiary. Funds remaining in the trust at beneficiary's death must either be retained by the trustee organization or paid back to the state. So that money is, make sure you don't accumulate any funds in the trust, because that money is not going to be able to be spent after an individual has passed, the beneficiary. And you technically don't need an attorney, although it's a good idea to consult with somebody, a professional that does this for a living. So how do pool supplemental needs trusts work? The Medicaid beneficiary makes deposits of their spend down amount into the trust every month. So that $100 has to go into the trust on a monthly basis. And you get a proof from the trust that you deposited the money, and the trust reports to the Medicaid administration that, you know, Joe has put $100 into the trust on a monthly basis. The money deposited in the trust is excluded from countable income for purposes of Medicaid budgeting. And excluding the deposited amount eliminates the person's spend down. And as a result, during that month, Medicaid is activated. Great. So how do we set it up? Okay, so the first things first, you need to enroll in a pooled supplemental need trust. And in your handouts, you'll get a list of trusts, non-for-profit trusts that operate in New York State. There is a, it's in a chart format, and you can compare prices. Each trust has its own administrative fees, its own requirements, its own documents that you must submit. And that's, at that point, you need to decide how much to deposit into the trust. And we're going to talk about this in more detail. Then once you set up the trust, you submit the trust documents and the request for disability determination to HRA or your local DSS with Medicaid application if you already don't have Medicaid. And so technically it's a two-step process. And I've always thought of it as a two-step process. Establish the trust and let Medicaid know that you have a trust. But there's a third step, and this is a kind of new. Upon request, submit a disability documents to the State Disability Review Unit. And we're going to talk about which documents, because there's a slew of new documents that the state is requiring. And of course, your last step is to always check that Medicaid budgeting was done correctly. How do we enroll in a trust? So first things first, you need to complete the beneficiary profile and the jointer agreement, and each trust has their own agreement. It has to be signed and notarized by the beneficiary. Yes, and just keep in mind the language here, typically a donor and a beneficiary are the same person. It can be signed by a POA, but as I said, you will need to submit the power of attorney document to both the trust and the Medicaid. You need to then pay the initial enrollment fee, and each trust has their own fees. You need to then fund the trust, deposit the spend down amount or more in the trust every month. It's a great idea to automate this deposit where you submit a separate form authorizing the trust to electronically withdraw funds from your bank account to be deposited into the trust, because the other option is to cut a check, and that, takes a lot of time by the time it gets to the trust and by the time they process the check. And at that point, you submit a disbursement or withdrawal form together with bills to the trust so that the funds that are available to you can be used towards either rent or a bill or some other ways to spend it out, and we'll talk about that. What does it cost? As I mentioned, it varies from trust to trust. There is typically a $200 one-time enrollment fee. There's monthly fees, and some trusts just have a flat fee of $20. Some have a percentage. There's typically a $50 auditing fee that's done on an annual basis. So you have to keep that in mind. The trust administration, all disbursements must be for primary benefit of the trust beneficiary. So you can't deposit your $100 or your $1,000 into the trust and then expect the trust to buy gifts for your grandchildren. Or you can't expect the trust to pay rent for somebody else. The actual rent payment has to be for you, the beneficiary, the Medicaid beneficiary. Disbursements must be submitted by a supporting documentation, i.e. a bill, an invoice. Disbursements can only be paid directly to third parties. So the point being here that you have this $1,000 in a trust. You can't cut a check to your landlord and then expect a return of money funds to you because you paid the rent. No, the trust money has to go directly to the landlord or to your Con Ed bill. And once again, this kind of reinforces the point: no cash withdrawals or payments directly to the beneficiary. You can never get cash back, even if you forgot that the rent payment is going to go from the trust and you accidentally cut a check to your landlord. The trust will never actually return the money cash to you. Distributions are made at the sole discretion of the trustee. So all bills are being submitted to the trust administration and they review everything in detail. They make sure that this money that they're going to disperse is not going to make you ineligible for Medicaid. Typically you can speak to the trusts themselves and make sure that, okay, I'm about to submit a certain bill. Are you going to pay it? That's a great way to make sure that the bills that you're submitting actually get paid from the trust money that's in the trust. Account terminates upon passing of the trust beneficiary. So once an individual dies, you need to let the trust know. And the money sitting there will no longer be allowed to be dispersed. And that's a federal policy that just prohibits the trust from cutting checks after an individual has passed. Let's talk about the types of disbursements. So I've created 3 categories. You can submit a bill receipt to pay a third party, for example, your landlord or Con Ed, or an insurance premium. For example, you may have a car and you need to pay the insurance for the car. You can make purchases using a credit card. So you can kind of put a bunch of bills on one credit card bill and submit the entire credit card bill, itemized receipts. Make sure that you submit everything and keep receipts for each purchase, because the trust may say, okay, well, prove that this purchase was for you. Or you can submit some kind of a quote or an invoice for service or purchase. For example, you may need some kind of a renovation for your home to make it more accessible. You may get a quote and then work out some kind of an agreement, a payment agreement, where the home repair is being paid on a month-to-month basis. So which bills can you pay with the money that's in your trust? I think typically rent is the best it's a fixed recurring expense, so you know that rent is $500 every month. And you can automate it because you can submit your lease to the trust, and they know that $500 is to be paid from January to December. And they will go ahead and pay it without even having to worry about it. You can always submit utility bills, cable, cell phone, credit card purchases. But keep in mind that these bills typically vary month to month. So it's hard to automate them. There is a way to have your utility bill go directly to the trust company. However, that just takes another step to set it up. Any credit card purchases, as I mentioned, you should always keep receipts. You can pay mortgage, property maintenance, and taxes. You can pay for transportation, vehicle expenses, insurance, as I mentioned. You can pay for groceries, clothing, and other personal needs. Uncovered medical expenses, for example, over-the-counter items. And entertainment, recreation. You can use the money that has been deposited in the trust to go on vacation. Really, and as I mentioned, and more, because they let your imagination define this, how the money is being used. But first of all, you need to decide how much money to deposit in the trust, or how much money is going to fund the trust. You can submit the bare minimum, the actual spend down amount. For example, as I mentioned, if your your gross income is $1,054, your spend down is going to be $100. So you can submit $100 to deposit $100 to the trust, and the trust will withdraw their monthly fee. For example, $20, and then you have $80 to spend on whatever bill that you want to submit. You can deposit enough to pay the full rent. If your rent is $500 and your actual spend down is only $100, well, you still have to pay the rent. So it really doesn't matter to you whether you submit, whether you deposit $100 to the trust and then pay the other $400 out of pocket. In fact, it doesn't make sense to cut two checks. But I have a client who insists on cutting $100 to the trust and $400 to the landlord directly. He feels more in control of the money that way, and that's fine too. And decide, when it comes to deciding how much money to deposit in the trust, you always have to be cognizant of the Medicare Savings Program. What do I mean by this? So, as I mentioned, having a trust allows you to qualify for the Medicare Savings Program. And as a result, you no longer have the $170 deducted from your Social Security check. Great. But in the eyes of Medicaid, this $170 is no longer counted as a deduction. So the money stays in your pocket. And as a result, it increases your spend down by $170. But that shouldn't worry you, because now, instead of losing the $170, I perhaps shouldn't be using the word losing, because you are getting a great benefit, the Part B coverage. By spending $170, you get to deposit that into the trust. And instead of never seeing that money back again, you get to submit bills that will go ahead and be paid by the $170 that has been put into the trust. So as a result, you have the ability to submit extra bills that will be paid out of the trust. But you have to be mindful when you're doing the budgeting for the spend down, you have to work off of the gross amount as opposed to the actual spend down, where you take into account the deduction for the health premiums. namely the Part B. Okay, so let's talk about some warning. Deposit only what you what you can routinely spend every month. Do not let the trust deposits accumulate. So it's possible that your spend down is actually not 100 or 500, but it could be 1,000 or even 2,000. You want to make sure that the money that goes into the trust actually gets used up, because you don't want to have the money accumulate. Accumulation could be deemed as a transfer penalty if at some point you're going to need nursing home care, and we never want to run into that problem. And you also don't want to, accumulate the money in the trust, because you never know when the time comes that you pass and then the money just got stuck there. And you also want to make sure that the whole point of this is that the money that gets deposited in the trust is being used for your benefit on a month-to-month basis. And another warning is that the S&T must be funded with your money. Like I said, you can't have your daughter or your best friend start depositing the spend down amount. It has to be actually your money that goes in. What are some prohibited disbursements? Well, trust expenditures must be primarily for the benefit of the beneficiary. You cannot withdraw cash from the trust. Items, gifts, expenses for others are not allowed. Items covered by government benefits are also not allowed. Capital improvement to property not owned by the beneficiary. You can't say that I'm gonna fix up my daughter's house. Leases between spouses are not allowed, because they're supposed to provide support to one another. And you can't go ahead and pay rent and mortgage and property taxes. It's either one or the other. It's Medicaid eligibility rules. And the last one, you can't purchase alcohol, tobacco, firearms, illegal activity, or bail restitution. Some tips: you want to always make sure that you monitor your account. There have been instances where an individual comes and says, well, the trust forgot to pay rent. I've had an incident where the trust, it wasn't a matter of them forgetting to pay rent. It's just that the lease ran out and the trust did not go ahead and pay the rent on a recurring basis, because they were under the impression that the lease had stopped. So you want to make sure that you submit your lease renewals to the trust. And the way you monitor your account is basically each trust provides you an electronic, very similar to the way you would monitor your bank account, ability to log into their website, and with typically they're password protected, and you're able to see how much is in your sub account. You want to make sure you utilize automatic deposits and withdrawals. Otherwise, it may take a really long time for the check that you cut for your spend down amount to get to the trust. The trust has to process that. And typically the trusts actually cut checks to your to either Con Ed or landlord. And so that in and of itself takes a long time. So you want to make sure that bills are being paid on time. Excuse me. Make sure your bank account has enough money when automatic withdrawals are scheduled to make sure that you avoid overdraft fees. And I've had instances where that $50 accounting fee that the trust charges you, well, it has to come from somewhere. So either you have to be mindful of depositing extra $50 when that time of the year comes, and each trust has its own time when they do it. There are some trusts that do it in January, some in the middle of the year. And if you deposit $100 to pay $100 of Con Ed, but $50 has already been eaten up by the accounting fee, well, you only have $50 there. So you want to make sure that you have enough money to pay your bill. And of course, this goes back to the first point, make sure you monitor your account. Credit cards are a great way to group expenses so that you can submit one bill to the S&T. Typically these days you can pay your cell phone, you can pay even and many other bills, including your Time Warner bill, Spectrum. So it's a great way to just group everything together. Your grocery bill, if you're not paying actual rent. Okay, so you've set up the trust, you've determined how much money is going in. Now what? Submit the trust documents and request for disability determination to HRA or your local DSS with the Medicaid application if you're not already on Medicaid. Okay, so what do we submit? Okay, first things first, the trust documents, and that typically includes the master trust agreement, the beneficiary profile sheet and the joinder agreement, the acceptance letter that you're going to get from the trust, and the verification of deposits. The verification of deposits is what tells Medicaid that you've essentially deposited your spend down into the trust, and that for that month, the spend down has been eliminated. And as I mentioned, it has to be done on a monthly basis. And you're going to get an accounting from the trust on a monthly basis, and you can always request an additional one from the trust administrator. So once you submit the trust documents, then you may also have to submit the Medicaid application if you're not already on Medicaid. And then you have to submit proof of disability. Currently, there's this one form, the MAP 3177, that's called the Request for Disability Determination. The new procedure is that HRA or the local DSS will forward this to the State Disability Review Unit. At that point, the State Disability Review Unit will reach out to you and ask you for separate disability forms that you will have to submit, and we'll go ahead and discuss those. And they're also included in your materials that you're going to get at the end of the presentation. And then you also have to submit a HIPAA release, which is the OCA official form 960, and a cover letter explaining to HRA or your local DSS, what have you done? I've established a trust. I deposit X amount on a monthly basis. I eliminated the spend down, and then as a result, I've also submitted proof of disability that I qualify for this program, and please, budget me without a spend down. And then Medicaid will process that. Hopefully everything will be done correctly, and then you get Medicaid turned on. Okay, request for disability determination. The S&T program is available only to people with disabilities. So the new form that you're going to submit, it's going to go to HRA or local DSS, and then at some point they're going to let you know what additional forms they need. But keep in mind that if you already have SSDI or SSI disability determination, then send a copy of the award letter or the disability determination to HRA or local DSS. This way you avoid having to submit all the other documents. And what are the other documents? It's the DOH 5143, that's the medical report for determination of disability. It gets to be filled out by your primary care physician that knows of you and your physical impairments. And in addition, this doctor is also going to submit 12 months of medical records. You also have to submit a disability questionnaire that you or your social worker will have to complete. And it's a series of questions, and you really, it's something that you need to all the information that's on there, you're gonna know with regard to what qualifies you for a disability. And then now there's a separate HIPAA form for the pooled trusts, and that's all of these are included in your materials. So now let's talk about a sample budget, okay? Because I've talked about with the spend down. Let's look at some numbers. How does it work? So you always want to look at your gross monthly income. So this individual has $1,872, and they pay for the Medicare Part B premium, $170. And then there's always the unearned income disregard of $20. Once you deduct 170 and the 20, you come to the net countable monthly income of $1,682. And currently the 22 Medicaid income limit for a household of one is $934. Great. So once you deduct $934 from $1,682, your excess income or your spend down for that month is $748. Okay, so you have the option of paying $748 to the Medicaid to activate your Medicaid for that month, but then it would make all the other expenses probably not affordable. So by depositing this money, $748, here we go, into a pooled trust, now that money is also counted as essentially a deduction. So it's the same income, gross monthly income, a $1,872. And we get to subtract the $170 and the $20 disregard. And the money that's going into the pooled income trust, the $748, then you get to a net countable monthly income of $934. Medicaid income limit for a single individual is $934, and then there's no more excess income or no more spend down, right? And as I mentioned during my previous slides, you have the option of depositing extra $170, okay, instead of paying the Part B premium separately and really never seeing that money back. You have the option of depositing not only the $748, but it's going to be $748 plus $170 that you're going to deposit into the trust. And as a result, you'll be able to utilize that 170 plus the 748 that's deposited in the trust as towards your rent or towards your bills or food and all the other expenses that we talked about. So that's how you come out ahead. Okay, so we have, I believe, some 10 minutes left over. Just briefly, these are some web resources. You're also going to get a comprehensive handout of how to qualify for a pooled income trust and how to eliminate your spend down. And I am happy to take questions right now if there are any.
Hi, Taya. So thank you very much. You covered a lot of ground. We do have some questions, and at this point, I would like to introduce Barry Langer. He's been looking at the questions that are coming in. And again, it's not too late to put your questions in, so please do it. I've been trying to answer as much as I can, and if I didn't know, I left it for Taya and for Barry. I just wanted to say one thing. If Kevin, can you put up the pre-questionnaire, the results, really quick? All right, so this is what people said. Most people said that they were between a 2 and a 3. It looks like 1, 2, and 3. So that's his level of knowledge on today's topic prior. And then we're going to put up a survey right now, like after Taya's presentation, how everyone's feeling. So please answer that. Without further ado, I'll introduce Barry Langer. He's a bill payer program and a DIFTA volunteer. He's been a partner in us, with us as we've put the Chat with the Expert into place, and he's our Q&A guy. And go ahead, Barry.
Hi, Tia. Great presentation and the number of questions. I'll try and cover the ones that may not be too specific, at least, and then we'll see where we are as we get to the 11 o'clock hour. How are retirement funds considered in terms of resources, in terms of the pay down?
Okay.
Like IRAs, so forth.
So I really went really quickly when it came to the income and the retirement funds. There are two categories, the monthly income and the resources. Typically, if it's a 401k and it's in distribution, the underlying value, let's say it's $1 million, 500,000, whatever, gets ignored. So if you're getting some kind of a yearly minimum distribution, let's say for easy numbers, $12,000 on a yearly basis, you take that $12,000, you divide it by 12, so you come out, you understand what your monthly income is. You add that into your gross income. So your Social Security check, whatever it may be, let's say $1,000, plus your other $1,000 that's coming from your 401k distribution. And now your income for the month of January and February is going to be $2,000. I'm assuming household of one, you take $2,000, subtract $954, and then that's how you determine your spend down.
Thank you. In terms of a Medicaid asset protection trust, should somebody do that, or is it important to have that prior to then applying for a pooled income trust?
Okay, Medicaid asset trusts are basically a different asset trust, where you put in a bulk of money, and then you get to use that money. There are similar rules. You can't take cash out. You can't use the money for somebody else. It has to be used towards the Medicaid beneficiary. But yes, they work similarly. We don't set them up. And yes, you can use that for Medicaid eligibility. There are various trusts. I welcome you to look at NYSARC. They have a Medicaid asset trust, and the rules are very clearly laid out.
Very good. I'm going to go back to the issue of the assets again. If your assets, I understand how you talked about excess income on a monthly basis for a pooled trust, but if you have excess assets, how does it get handled in terms of eligibility for a pooled trust?
Yeah, and I'm sorry for kind of really going over this really fast, because the first two parts of this series covered, and I didn't want to bore people, but basically this is the thing. If you have too many assets, Medicaid switch can't even turn on. So basically for a household of one, this year it's 16,800. So
again, you can't use the pooled trust to protect those excesses.
You can,
Oh.
but if you're applying for Medicaid, and you have assets over that amount, the switch won't even go on, basically, right? You don't qualify for Medicaid. So we're not even moving on to the next step, discussing the income portion until you are within the asset limits. And then then the next step is to make sure that your income is within the Medicaid limits. Let me know if I answer that question. So basically,
I think
yes, you
did.
can
And I would
protect
say
the
that
assets.
I would say that if the person who asked it feels they hasn't, they should contact you directly.
Okay,
Get it
absolutely,
clarified.
absolutely.
And I think you kind of covered this, but just again to clarify, for a Medicaid savings program, you have to apply for that separately, right, from the pooled trust. That's a separate.
So there is a benefit. So it's very possible that you apply for Medicaid, you don't have it, or you can be at different stages. You can have just the Medicare Savings Program. You can then need Medicaid services, for example, long-term care services, and you have to apply to the Medicare Savings Program. Now that you qualify, because you're putting all the spend down, all the excess income into a trust, now you qualify for the Medicare Savings Program, and you let in your cover letter, you let Medicaid or the local DSS know that now you've qualified for this program as well. Make sure you activate that as well. And as a result, once everything is processed correctly, Medicaid will let Social Security know, and that $170 that's now being deducted will get put back in, and the Medicare Savings Program gets activated.
Very good.
So you could be at various points. You could either apply for MSP separately, or you can, within your cover letter, once you've established the trust, let Medicaid know that now I'm depositing my entire spend down. I fall within the MSP limits. Please activate MSP.
Okay, in terms of the pooled trust and being qualified in terms of disability, being over 65 is not enough. You need to be also have a disability. And part 2 is, can you define a disability? Or is that
So
too specific?
that's a great question. You're right. Just being 65 doesn't automatically qualify you. It's very possible that you have a disability determination from Social Security Administration prior to 65, and you'll submit that letter. But if you don't, you will have to show disability separately by filling out all those separate forms that were discussed.
Okay. I'm going to ask one more question to David. There may be a bunch of questions I'm missing because I'm going through the list I had from before. I may pass it to you as I start going back. What is a special housing deduction?
So an individual may have had a fall. They go into a nursing home. They stay there for over 30 days. And now they come back, they need long-term care because they can no longer be safely at home. They need managed long-term care services. So the special housing deduction says, okay, now that you've been in a nursing home facility for over 30 days, you have another deduction, and it varies by region. And it's set amount depending on where you are, and you submit a separate form saying I qualify for this, and it's an X amount that gets taken off your gross income. As a result, lowering your essentially that spend down, that money over the 934 plus 20, and you come within the Medicaid limit.
Very good. David, I'm looking at a bunch of questions. I think there's a lot of definitional questions. There's still the issue of the $170 from the how the MSP covers the Medicare Part B. And I don't know that it may have to be one-on-one. I'm just thinking, David, because it is a complicated question. I think I get it 80%. And I just think that maybe that's one-on-one counseling. And I'm going to ask just a separate question in terms of that. Is your range, your geographic location for NILAG, the city or the state? In terms of your service?
It depends on the service. We have various groups within NILAG that cover different regions. For example, the unit that I'm in would cover the city and Westchester and some parts of Long Island. I speak for my group only, but it varies.
Okay, thank you. So David, do you see what I'm saying? They're just
Yes, I do have there seems to be like, I just want to ask a general question here. So there seems to be like a lot of confusion about verification of deposit once a pooled trust has been set up. Okay. I know at the bill payer program that we run into this problem all the time, which is that everybody assumes that everything is that Medicaid is on it and they're checking, and yet clients would get a bill as if they didn't have the pooled income trust in place. So can you talk for a second about verification of deposit? It seems like some people are saying, oh, well, I was told by HRA that it happens automatically. We've had instances where clients didn't have it happen, and then we had to provide proof of deposits by going into helping people to get access to their checking account so that we can verify that these deposits were made. Can you speak for a second about that?
Sure. Okay. So on a very basic level, we talked about what the Medicaid limit is, and any money over that is called a spend down, and it has to go into the trust. So that in the eyes of Medicaid, this money, poof, kind of disappeared. It didn't disappear, it went into a trust. But Medicaid on their books looks at your budget and says, okay, you no longer have this money in your possession. Great. So what verification of deposits does is it proves to Medicaid that this money actually went into a trust on a monthly basis. Now, the trust should be sending verification of deposits. Initially, they send the paperwork to HRA or local DSS. During every recertification, it is your burden to submit proofs of these deposits to HRA or local DSS. If you're talking about at the initial point, you've set up the trust, the trust sent you the welcome letter in the packet, and there's just that initial deposit. They don't send you a whole slew of deposits because that hasn't happened yet. So, Medicaid needs to know about those deposits. If you've only submitted the application fee, for example, $200 plus the initial fee plus the minimum deposit, $240 for, I'm specifically talking about Center for Disability Rights Trust. If that was your only deposit for the initial month, that may or may not have satisfied your spend down. So for purposes of Medicaid, your spend down may not be satisfied. Verification of deposits needs to go to Medicaid to show them that every month that premium, that spend down, is going into the trust. The cover letter gives you an opportunity to let Medicaid know that you're going to be depositing either 500 or whatever the spend down is on a monthly basis. And during each recertification, you need to show Medicaid that the $500 for the past year has been deposited. It's a monthly thing. It is kind of an onus on the Medicaid beneficiary to submit that on a monthly basis.
Okay,
I apologize. It doesn't need to be submitted on a monthly basis, but it needs to be shown that it has been satisfied each month.
Right. So I just wanted to verify, because several people have this question, that the onus is on individuals, that
Yes.
that the trusts don't always do a good job, and that the provider, the healthcare provider, may not really know unless you are able to prove that the money is going into a trust. And that's why people may be getting bills for the
Yes,
cost of their
absolutely.
care. And that's a
Absolutely.
regular feature, even though HRA may say that it's not. The other thing that we had a number of questions that people are really confused about assets. I don't know if we have enough time to really talk about assets, but people seem to be confused about RMD, I guess, as
Required
income.
distribution.
Yeah, whether that's considered to be, can you talk for a second about RMD?
Okay, so required minimum distribution, the rules have changed recently. For a Medicaid applicant, you're supposed to take any available income, take advantage of any available income that is due to you. So even though IRS says you can take it later, Medicaid kind of forces you to take it earlier. Okay, so if you're 65 applying, well, you're going to have to show them that you're taking every possible source of income. You may have to put your IRA into distribution. Once it's in distribution, the IRA underlying asset value gets ignored by Medicaid. So it's possible that you have a $50,000 IRA. Medicaid will not look at it. will ignore the $50,000 as long as it's in distribution. If it's not in distribution, then it counts against that 16,800 for household of one. And then you don't qualify for Medicaid. I'm not sure if that answered that question.
I think it does. I know we've run over time, so I just wanted to thank you, Taya, for this presentation today.